One of the things that we like to say amongst ourselves is, it's not really about changing the way you look. It's about changing the way the world looks at you. The average time that anyone thinks about having a cosmetic procedure before walking into our office is 2 years. The way we kind of think about that is that's 2 years that you could have been really living your best life, right? I mean, those are 2 years that you could have had this thing that holds you back taken care of.
Even on the cosmetic side of plastic surgery, we are changing lives. I mean, we are making people happier. Statistics show that people are happier, healthier, more successful in their business after cosmetic surgery. People carry themselves differently when they're more self-confident, and it makes you more successful. It makes you more powerful in a meeting, and people are just happier and more successful both in life, marriage, and work. Welcome to Plasticos, the everything you ever wanted to know plastic surgery podcast with me, Dr. Christopher Park, and host Kim Anderson. We will discuss surgical and non-surgical plastic surgery options and the ways that they improve your health, mood, personality, and success.
Hi, and welcome to Plasticos. It's the podcast where you get all your questions answered about plastic surgery, anything you wanted to know. I'm Kim Anderson, along with Dr. Chris Park and Dr. Ryan Rebowe. Hello, gentlemen. How are you today?
Doing well, and you?
I'm doing great. How are you?
I'm doing great. Now, Dr. Park, we talked several times on this podcast, but let's talk about your new partner here, Dr. Ryan Rebowe.
Yeah, I'm very excited to finally have a partner that I would want. This is Ryan Rebowe. He's a friend and a partner. He's been with me since July of 2019, and we're very excited because it makes us more available, allows us to do some things that were difficult to do by myself, and he's just a great guy to have around, and we have similar ways of thinking.
And Dr. Rebowe, you're a Southern guy as well, a little Southern Creole,
That's
Louisiana
right. Yeah.
thrown in there.
Yeah, I'm from Baton Rouge originally. And then, Chris and I actually, it's funny, we have very similar backgrounds in terms of education. We both went to University of Virginia for undergrad, both went to our state medical schools. That's right. Go Who's, 2019 national champions. No big deal. So we both went to our state medical schools, and then we both trained for plastic surgery at Wake Forest, which was a phenomenal place to train. We got exposed to pretty much everything plastic surgery related, but it really allows us, I think, to work very well as a team, and of course helps that we have similar interests outside of surgery in terms of being outdoors and do a lot of hunting and fishing and enjoying everything the Gulf Coast has to offer.
So you're a true Southern guy.
That's me, yep.
And you love living here along the Gulf Coast.
I do. That's what sort of my wife and I, we love North Carolina. North Carolina was great. East Coast life is wonderful. But we really wanted to be back along the Gulf Coast somewhere, not just be close to the water. But I think most people from the area would tell you that, the Gulf Coast has a great just Southern culture. It's very different than even other parts of the South. And so, spending time in Baton Rouge and then New Orleans, we kind of wanted to be back along the Gulf Coast. And to be totally honest, I'd never spent a lot of time in Mobile until I heard Chris was looking for a partner. I came down and met him. And the more time my wife and I spent here, the more we loved it. I think it's a great amalgamation of a lot of the culture from other places in the South and along the Gulf Coast. And we really loved being down here for the last couple months.
And Mobilians seem to embrace everyone and just make you feel
absolutely.
like you're at home. So I love that. Now, you mentioned New Orleans. Let's talk a little bit about your educational background. You said that you went to grad school, a little different route after your undergrad. Yeah,
absolutely. I did undergrad, and then I did a one-year master's in cell and molecular biology, kind of help prepare me for medical school. And I thought it was a really good transitional year for me. Just in terms of getting a little bit more into the science aspect and, really getting a little bit heavier into a lot of the stuff that I wound up using in medical school. And it wound up being a very good year for me and transition before medical school. Not something, cell molecular biology, honestly, not something I'd use every single day now as a plastic surgeon, but it was really good at the time.
Any specialties that you may have that people want to know about?
So in terms of, surgical specialty, I think the big thing that I will bring to the table just as a team, I wouldn't say that, I didn't do a microsurgery fellowship or anything like that, but I would say that Chris and I both enjoy doing microsurgery and offering that, by that I mean free flap reconstruction, both breasts and otherwise. And being here allows us to work as a team. It's something that's hard to do as a solo surgeon. having both of us here and both having an interest in that is going to be, I think, really good for both of us. And then, in terms of cosmetic stuff, both of us do a large amount of breast surgery. And of course, that is one of our specialties. But personally, I really enjoy facial aesthetics. And I feel like I really kind of focus on that in terms of my cosmetic work.
And women love that. We want to always look younger.
That's right. Exactly.
Hold on to the fountain of youth and as much as we can. So this allows you to see more patients.
It does. I think it's really ideal to kind of have two people that are very similar. No matter where you train in anything, but especially in plastic surgery, there's different ways of thinking, different ways of addressing a problem. So it's nice that, we all both spent 6+ years at Wake Forest kind of learning to think the same way. We're not butting heads. Just naturally, we kind of feel the same way, think the same way. But like Ryan mentioned, it is hard to be a one-man show with a lot of these things. You can't be everywhere you need to be and do the 8-hour surgery when you have to do it if you've got other things going on. So I just kind of feel like we've kind of just doubled me with a great surgeon and a great decision maker and a smart brain and able to do the things that we need to do and do them better and more efficiently and be more available, both to Mobile and Baldwin County. We try to serve this whole area. Which
is great because more women and men, because men come in and see plastic surgeons as well. Yeah. And I tell people all the time that, it's just more than just cosmetic plastic surgeries because you operated on my son on his hand when he had 2nd and 3rd degree burns on his hands. And tell him to this day he still has full mobility thanks to your awesome work that I almost threw up on watching.
Yeah, it's nice to do everything. And that's really what Wake Forest was fantastic at. It literally did everything. And I saw that when I interviewed there, and I'm sure Ryan did too, and that's why I wanted to go there. It really was a great preparation for everything. So we try to do that here and help out with trauma, help out with cancer, help out with cosmetics, help out with everything there is with plastic surgery. We operate head to toe on everything from 3-week-olds to 100-year-olds. It's why I chose plastic surgery.
Yeah, I would 100% agree with that. I think that was the thing that drove me to Wake Forest for training, but also the thing that brought me here to Mobile is, once I came down and met Chris and sort of heard what he did and heard what he's trying to do, and his biggest problem was not that he was trying to limit what he did, but that he wanted to do more. Again, I would agree almost 100% with Chris on that I enjoy plastic surgery for being able to do the entire breadth of what we are able to do. And so being in a place and being in a position where I can do that and feel like I'm supported in doing that, not just in words, but in action, has really been great. I think one of the things that I've really enjoyed, and I think Chris has too, is that, since I've been here, we've just tried to be just an absolute team, helping each other out on surgeries. And I think it's not just better for us in terms of getting things done, but it's better for patients. People are getting 2 brains in the operation. People are getting decreased surgery time. I just think that overall it's been a really great experience, hopefully for the patients. I think for the patients, but definitely for us.
So it's a win-win for everyone around here with you bringing a partner in. That's awesome.
Yeah. And I'll be honest, as a solo person, it was hard to be off. Now I have somebody I can trust when I'm off. If I'm out of cell phone service for 3 hours or whatever, it's nice. And same for him. I hope he never has to experience that being alone feeling.
Me too.
I'm sure that makes your wife and your kids a lot happier. Oh, we get to spend more time with you.
Yeah. Well, we're still working
see how
hard.
That goes.
We're still working hard, but like I said, I try to serve the Eastern Shore. It was several years ago, I think 2014, that they had a big need. The plastic surgeon over there got hurt and was not available, but that's even hard to be over in Fairhope when a patient has an issue in Mobile. So that helps as well.
So you can be 2 places at once with now.
Certainly, it's a very cool and very unique thing in Mobile to sort of have those 2 communities so close to each other, kind of different vibes, different communities. But it's great for us to be able to serve both and I think now with both of us here to do it well. It's been very rare since I started that someone wanted to see either he or I in Fairhope that we couldn't accommodate. And we're hoping to sort of continue that and grow that over time. And I know that It's been hard with Chris as a solo practitioner, but I think that with both of us here, and I think that, that's going to just continue to grow over the next couple of years.
Now, if somebody wanted to get in touch with you, gentlemen, let's talk about that, because I'm sure there's a lot of questions. People want to make appointments, things like that.
Yeah, I mean, we've always got the standard ways of calling in. The easiest number to remember is 251-340-6600. It's a standard medical office, so in that situation, you'll kind of go through the front desk and usually end up with somebody fantastic like Sydney. But people just need to realize we're very approachable, and we allow people to get in touch with us easier than they think. I mean, they can just email through the website, and it'll actually land in my in basket, or they can email us directly. I mean, I'm Dr. Chris Park at gmail.com. That's DrChrisPark. And Dr. Rebowe is Dr. Rebowe at gmail.com, DrRebowe at gmail.com. And, we will answer you directly. It may be at the end of a surgery or when we wake up or whatever, but we're happy to do that. It's not an imposition.
And for somebody who's a little bit shy about trying to come into an office to talk to a plastic surgeon, thinking somebody may even look, you've got virtual online consultation.
We do. So our website's www.mprsd.com, and on the homepage, if you scroll down on the right side, there's a virtual consultation. It allows you to put a little bit of history, what you're interested in, and even upload photos if you're interested. Obviously, we see that every day where people are so scared and been taking years or months to come in. I really would love to quell that, because it is nothing to be embarrassed about. It is what we do day in and day out, and we're here to help. I mean, and the more you're embarrassed about, the more excited I get, because the more I can help you. I mean, I've seen the resting face change to where their face is flat all the time because they're just not happy, and then after surgery they come in as this bubbly personality. Even on the cosmetic side of plastic surgery, we are changing lives. I mean, we are making people happier. Statistics show that people are happier, healthier, more successful in their business after cosmetic surgery, whether it's visible. It's not just making you look younger. You're trying to compete in business as a 55-year-old, and you're losing out to some of the younger people. Making you look younger in your face can certainly help. Ignore that. Let's just say we fixed your tummy after having 4 kids and nobody even sees your stomach. People carry themselves differently when they're more self-confident, and it makes you more successful. It makes you more powerful in a meeting. It makes you more pleasant to be around, and people are just happier and more successful, both in life, marriage, and work.
You're so right.
Yeah, I mean, I think one of the things that we like to say, just amongst ourselves is, it's not really about changing the way you look. It's about changing the way the world looks at you. And I think another thing that really helps people to hear this is that the average time that anyone thinks about having a cosmetic procedure before walking into our office is 2 years. The way we kind of think about that is that's 2 years that you could have been really living your best life, right? I mean, those are 2 years that you could have had this thing that holds you back taken care of. But just remember that, if you are thinking about doing something for yourself, that you're not the only one. There's so many people out there that are thinking about doing the same thing. And really, again, they're going out and they're living their best life.
Kind of changes your whole attitude, your whole outlook.
Yeah, exactly.
Yeah, there is no problem with coming to see us early, because we will a lot of times tell you 2 or 3 or 4 things we want you to do before we do proceed with surgery, and whether that's quitting smoking or losing 12 pounds or getting healthier in some other way, shape, or form, getting off a certain medication that somebody started you on. So people a lot of times will wait that 2 or 3 years and then come in October and think they're going to have their surgery in November, and we may have to say that's not going to happen because of, if there's some health issues or weight issues or something like that. So just see us early. I mean, we don't mind, and hopefully we give you a lot of information and a little bit of motivation and help you plan for the future.
And another thing is, there's really nothing minor about a problem that really bothers you specifically, right? I mean, I think that's another thing we commonly hear is that they say, well, I really wanted to come in for my lower lids, but, people have been telling me for years that it's just so minor. Why would you get that checked out? But if it really and truly bothers you every day, if it's something that you focus on, it's affecting your self-esteem, there's nothing minor about that. And even if you're not a good candidate for surgery, whether or not it's other medical problems, or maybe you're just not quite ready for surgery in terms of severity, there's other things that we can do to kind of temporize it and make it better and just give you, again, a new outlook on life, a better way to carry yourself. There's so many things in terms of non-surgical options between injectables, lasers, even a good skin regimen can really change the way a person views the world.
And that's where the med spa comes in as well.
Yeah. I've got some breaking news. You're not going to figure out what you need on Dr. Google. So, there's so many things we do. Even my staff can't keep up with everything that is an option that we know from reading, from training, or sometimes even just from our gut. Like when I see a patient, I can kind of think of a variety of things we may offer. So it's not just have a consult and
come on in and talk.
And we may suggest something you've never heard of. If you want to go research it or think about it, that's fine. But I mean, I'm just saying that even selfishly. I can't evaluate things without looking at you or sitting down or even meeting you and understanding your goal a little bit. And it doesn't have to be for some major mommy makeover, extreme body change. It may be for an old scar or an eyelid that's slightly droopy or wrinkles on your hands or whatever. I mean, there's so many things we do.
I never even thought about that they can do something from wrinkles on the hand.
Oh, yeah. Hand rejuvenation it's a new thing. It's a new frontier of plastic surgery.
Yeah.
Oh, wow.
Yeah.
I mean,
that's a whole nother podcast.
I was to say, a whole other episode.
I mean, and I think Ryan and I have mentioned this before, part of the reason we like plastic surgery is the variety. I mean, if I literally could list every, not just procedure I've done, every type of procedure I've done, it's in the thousands, if not 10,000s. I mean, we can operate anywhere on anything that, if it's appropriate.
Well, one of the things, too, about just coming in for a consult and seeing what you need, I mean, again, going back to the benefit of having two surgeons and having two surgeons that are very good friends. I mean, I think the other day I went like 2 days without talking to Chris, and it was like the first time in like 3 months that we've been 2 days without talking to each other. But, my point is that we frequently bounce things off each other, just whether it's cosmetic, reconstructive, just to make sure we feel like we're covering all the bases. And it's not infrequent that one of us will mention something that the other one didn't even think about, right? And it's nice to just have two brains thinking about, what we can do and what we can offer our patients, which is very nice.
And two brains are better than one.
That's right.
We always hear that. All right, now for other people who may have questions, what's the best way to get in touch with you?
Just give us a call at 251-340-6600 or email us at info@mprsd.com or visit the website at mprsd.com.
All right, thank you, gentlemen.
Thank you.
Thank you.
Thanks for listening to Plasticos Podcast. Please follow us on our Facebook page, and please rate and review Plasticos on iTunes and anywhere else you get your podcasts. This really helps others discover this show. Have a plastic surgery question you want us to talk about? Contact us on our Facebook page or email me at drpark@mprsd.com. That's drpark@mprsd.com. Plus, we really want to hear what you think about our episodes, so let us know. Thanks again for listening, and remember, insist on credentials, invest in results.